Good morning. My name is Anna Kremer. I have multiple titles, officially Public Information Officer, but also I lead the Office of Communications and Outreach. So sometimes in my email signature, you may see Communications and Outreach Coordinator, but both titles. Excited to talk a little bit about the health department today and all that we do, which is a lot. Happy to have this be somewhat interactive. So if you have any questions, feel free to interrupt me. I will start with a little bit of history. I won't go into everything, but when I moved to Springfield and started working at the health department, I thought it was very interesting that this was the Springfield-Greene County Health Department, the hyphenated name there. And that's because we started as the City of Springfield Department of Health. Our primary focus at the time when we were founded in 1873 was sanitation and water supply. So very basic health functions there. And it wasn't until 1925 when we partnered with the Greene County Health Unit. So Springfield Health Department and Greene County Health Department used to be completely separate, two different entities. Throughout the 1900s, you'll see different functions get added to the health department's purview. So food inspections, communicable disease, environmental sanitation. For a period of time, we did manage a hospital. So we were primarily focused on providing care to the medically indigent, so those who could not afford care. So it was called City Hospital, if any of you are familiar with City Hospital. Eventually, City Hospital closed and those patients were shifted to Cox and St. John's. And we continued functioning mostly with our original functions of food inspection, sanitation, et cetera. In the late 1970s, when WIC, Women, Infant, and Children's Program, started federally, our health department began administering that program as well. But then it wasn't until the late 1970s when we officially merged the Springfield Health Department and the Greene County Health Unit to be Springfield-Greene County Health Department, which is a mouthful every time I say it on the phone when I answer. But that is our official title. So we represent both and provide services both to City of Springfield and Greene County. And I will say, before I jump into what we do today, I know it was on the agenda talking about our temporary relocation. So we have already moved back to our building, actually. So earlier this year, back in March, we moved from the Harold Bench building over to Cox Medical Tower. We were renovating our building to have a new HVAC system. Our temperature was not very well regulated for a period of time. We were able to get some funding to get that fixed. So we were over at Cox Medical Tower, enjoyed sharing the space with some of our other Greene County folks up until mid-October. And then we have now made the move back. So happy to report that our HVAC system works well these days. But so as for what we do today, it is a lot. I will go into each of these. Again, please feel free to ask questions. Some of these programs, I think people are unaware that fall under the health department's purview. So I think it's kind of interesting to dig into. Our three most external facing programs or divisions are our environmental health division, our communicable disease division, and our maternal child health division. So I'll break down each of those. So food safety, this would be our food inspectors. So they go to restaurants and they enforce local and state regulations as it relates to preparing and storing food, both in the city and the county. So think restaurants, bars, schools, anywhere that there's food prep. So even long-term care facilities, they also inspect. We'll talk about some statistics later, but our food inspectors have different rules based on our ordinances of how many times per year they have to inspect different types of facilities. So they will do several thousand inspections per year. So they are quite a busy group. Our animal control officers work primarily towards the prevention of spread of rabies in our community. They will do enforcement and also education. So within the city limits, this is one program that has slightly different ordinances depending on whether you're in the city or the county. But within the city limits, they investigate animal bites, contain aggressive dogs, and secure dogs that are on the loose. So if you see a dog wandering around, not on someone's property, they will go and secure the animal. If you're in the county, they also investigate dog bites, investigate aggressive and/or vicious dogs, and then assist Greene County Sheriff's Department officers with investigations or emergencies. So if there's an emergency call out in the county related to an animal, our animal control officers will partner with the sheriff's office to investigate that. They'll also pick up injured animals that they find throughout the community and bring them back to the shelter. And we have a vet that we contract on staff to try to take care of those animals. Water safety and lead testing, I think those are a little less interesting, but very important as well. So water safety, primarily what that one is, it's almost a temporary function of our health department. Over the summer, we have inspectors that test pool water. So public pools, they will test and make sure that the chemical levels are appropriate for all of us to enjoy swimming in the pool. And if they're not, they work with the pool to get those levels back into balance. So primarily those are during the summer months. And then lead testing has to do with, there's a federal program that regulates if infants test with a amount of lead in their blood level, then the community will, or excuse me, our department will help investigate that to try to determine where their exposure to lead came from and try to mediate those exposures. So think like lead paint or things like that, and then help families get educated on how they can minimize that lead exposure. You know, that was a lot on environmental health. Any questions? Yeah.
So I understand, like when it comes to law enforcement, all the cities have their own police, and then the county has the sheriff patrolling the unincorporated areas. But I'm unclear, how does the health department, like food inspections, if there's a restaurant in, you know, another city that is part, do they have their own health department? Do they contract with you? How does that work, the other cities in Greene County?
That's a great question. So it really depends on the city that the restaurant falls within the county. Our inspectors will still go out to those restaurants, primarily if there is not an ordinance in the city that that restaurant falls in, outside of City of Springfield, related to a specific process. Our health inspectors will kind of provide the guidance of City of Springfield, but they're not requiring that because, of course, legally they can't say you would have to follow this law because they're not within City of Springfield. They have other, they have their other ordinances. But again, it's guidance. That would be their recommendation, but they have no enforcement mechanism there.
Do other larger cities have their own health department?
No.
Okay.
So we cover all of the county area. Yep. Yeah. Did you have a question?
Did you have any impact on the boil odor this last week with the, I mean, were you the ones that were testing it right off the bat, or did
No. So what happens in the boil advisories like that is we primarily serve as an extension for communication purposes. We were notified by city utilities that that was going to happen, and then our leaders within our food safety team called restaurants to let them know that city utilities was also going to be contacting them and just making sure that they received the information, knew what they needed to do. But we do not do any of the testing in that scenario. That's city utilities and then Department of Natural Resources, which is a state entity. Yeah, any other questions?
Is there any restaurant you won't eat at?
You know, I'm not going to lie. I actually do not like to read food inspection reports, not because, restaurants are an issue, but I'd rather not know. Yeah, but they are available publicly on our website. So if you are interested, you are welcome to peruse our food inspections. Any other questions? Okay, communicable disease. So fun. I think as a result of COVID, everyone is more familiar with this language than they used to be. But starting off, we have epidemiology. So that's really just the study of the transmission of disease. So our epi team really works to prevent the spread of communicable disease by investigating any occurrences of communicable disease. So long story short, because I have training in epidemiology, so I could talk about this for hours, the state has a list of infectious diseases that we are required to investigate. So I think it's over 100 different conditions. Think the flu, Legionella, things like that, that tend to be very serious conditions as it relates to mortality or morbidity. So we will find out that someone in Greene County has tested positive for one of these conditions, and then our epidemiologist will investigate to try to mitigate the spread of those infectious diseases. Our immunizations team primarily works to give out immunizations. So at our clinic, we provide both routine vaccinations and travel vaccinations. So if you're ever traveling and need some vaccinations to ensure that you are safe while you travel abroad, our clinic does that as well. So we vaccinate for kind of more regular viruses like Hep A, Hep B, tetanus, measles, but then a common travel one is Japanese encephalitis, typhoid, etc. So all of that is available at our health department. And then we also work to offer vaccines through community outreach events. So some examples of that is we have a grant program actually funded by Greene County that works to provide vaccines for senior citizens. So shingles and Tdap, which primarily vaccinates against pertussis as you get older, those are available through that program and available through those outreach clinics. Our STI clinic, somewhat similar to epidemiology, will work to investigate and to prevent the spread of sexually transmitted infections specifically. They do confidential testing and treatment. So you can come to our clinic and receive completely confidential testing for any sexually transmitted illness. And also, depending on what illness, what symptoms you have, you can also receive treatment. Laboratory services. This is one that sounds basic, but I think is interesting. So laboratory services supports many of our programs in the department, actually. They do laboratory testing. So any testing that we do in our clinic, our lab runs those tests. So for like our STI clinic, but even if you think of animal control, if we have to test an animal for rabies, our lab runs that test. Another fun fact is that we publish daily pollen counts. So our lab tests that. We have something on top of our building that collects the pollen every day, and they run that test and report out what the pollen levels are. So somewhat unique service there. And then finally, our tuberculosis program, mouthful. Again, similar to epidemiology, they are investigating and trying to mitigate the spread, but specifically of tuberculosis. Any questions on communicable disease? That one's a bit more straightforward. Okay. Maternal child health, women and babies. So these two programs, WIC, which stands for Women, Infant, and Children, is a program that works to provide nutritional benefits for pregnant, postpartum, and breastfeeding people, along with infants and children up to the age of 5. So there are different guidelines on what the food distribution is for each of those categories of people. But all of those categories of people, so again, pregnant, postpartum, breastfeeding, infants, and children up to the age of 5 can all receive food benefits. What else about them? Oh, they also provide breastfeeding assistance. So if a postpartum mom is having difficulty breastfeeding, we have lactation consultants, and they can assist with that process as well. And then Family Connects is actually a newer program to our department. It launched as a pilot project in March and then more broadly in April of this year. But it is a free universal in-home nurse visitation program. So lots of adjectives there, but again, so free, all families in Greene County, and then for families with newborns. So whether that be that they just had a baby, they adopted a baby, they are fostering a baby, any one of those situations, a nurse completely voluntarily to the family, they get to choose if they would like to have this. A nurse will come to their home and assess parent, assess baby, and provide referrals to community resources that they may need, and really just provide support. Kind of one of our taglines is, babies don't come with instruction manuals. And I am currently pregnant with my first, so I feel like I can attest that that is true as I prepare for this baby. So we are very excited to be offering this program to all families in Greene County. Any questions on either of those two? No? Okay. So now we get into more our less super obvious external facing divisions, but we have chronic disease prevention and administration. So within chronic disease prevention, we have 3 different programs. Our jail diversion program. So this is a partnership with city municipal court. So it's only available for city residents, or excuse me, people interacting with city municipal court. The program connects participants with mental health, healthcare services, recovery services, community resources, and more to prevent recidivism. So prevent repeat crime, basically. It is through municipal court, so they are municipal charges, but this is a program that we launched this past April and has been having great success since. Revive is an effort to address high rates of opioid overdoses in Greene County. So back in June of 2023, our department launched a smartphone app. So it's called Revive. So if you would like to download it, you can do that. It provides step-by-step rescue instructions on how to administer naloxone or Narcan. So if you encounter someone experiencing an overdose, you can administer Narcan. Info on where to access naloxone. So if you would like to have naloxone in your personal supply, we encourage everyone to have naloxone. It's a great first aid kit addition. You never know when you're going to encounter someone experiencing an overdose. Info on Good Samaritan laws. So Good Samaritan laws are the idea that, they're laws that prevent you as an individual from receiving any criminal charges for being around someone when they are experiencing an overdose. So you would not have any criminal charges for paraphernalia, I'm blanking on the word, but having any drugs on you when the police come to respond to that overdose. So that is what a Good Samaritan law is. So if you would like information on that, you can access that in the Revive app. And then also local treatment and recovery services. So lots of great information available in that app. And then finally, In Balance. This is more of a internal to the city program, but it's our City of Springfield employee wellness program. So we actually manage that within the health department for City of Springfield. What questions do you guys have on that? Yeah.
Anna, what changes have you seen in that imbalance program, over the recent years? Has the program changed and what's provided to the employees, or has there been any shifts in that?
So we've seen, I'm not sure how long we've offered discount for the family centers in our community. So that's one thing that many employees take advantage of. So the 3 family centers that we have throughout Springfield, along with Cooper Tennis. We have seen one benefit that we keep expanding every year is that we offer flu vaccination clinics in the fall through Imbalance. So we make it possible, instead of having to go to your provider or to Walgreens or to CVS on site at multiple City of Springfield locations, you can get your flu vaccine. What other benefits? Trying to think. I can get back to you on that.
Okay.
Yeah. What other questions? There's water. Talking a lot. Okay. Administration. This one's the most boring, but it's what I'm in. So this is really just the administration of the health department. So we have our health operations team, basically our business office. An extension of this team, though, does provide vital records like birth certificates, death certificates. So they do interact with the public. So if you wanted to come to the health department and get a birth certificate or a death certificate, they would assist you with that. Office of Communications and Outreach, that is me. We primarily work to provide timely information to the community through multiple channels, whether that be mass media, social media, print media, etc. Office of Community Health Strategy supports collection, organization, and analysis of data so that we as a department can make more evidence-based decisions. So they are, I say this lovingly, but they are our data nerds. And I am also a data nerd, so I appreciate them a lot. And then Emerging Public Health. So very official name, but basically what they do is help us make plans for emergencies or just have policies and procedures in place. So kind of an extension of the Health Operations and Business Office. Any questions on those?
Anna, do you have a staff, or is it a one-shop person?
I have a staff, but it is very lean and mean. So our team is 5 total, including myself. So it is me, another who is basically a mini-me. We have a contract employee who specifically works on a campaign called Hey Man You Good.
Yeah.
It's our men's mental health campaign. And then we have a web designer. So that position runs our social media and all of our graphic design. And then we have a policy analyst. So that is our team of 5.
And they're all full-time?
Yes.
Wow.
Mm-hmm.
Okay.
Yeah. What other questions? Okay. We'll move into some numbers. Because again, I said I love data. But I think it is nice to kind of quantify. Oops, I went too far. There we go. Quantify some of the impact that we have on the community. So food safety, remember these were our food inspectors. And I said that depending on the type of facility, they may have to do 3 inspections a year, they may have to do 2 inspections per year, etc. So year to date, these are fresh numbers, they've done over 2,500 food inspections throughout our community thus far this year. So they are quite busy. And we have 18 imminent public So what this might mean, this is not a pretty picture, but let's say sewage backed up in a restaurant. they would close the restaurant because that would be an imminent public health risk. You would not want to be eating food from that restaurant on that day. So things like that are considered imminent public health, and they will close the restaurant. So they've had 18 of those, not specifically sewage, but things like that throughout the year. And our animal control team has responded to over 10,000, almost 11,000 calls thus far this year. So very busy.
Is there a specific animal they won't pick up?
Oh, that's a good question. I don't know. That's never come up before. I'm going to ask them that. That'd be a fun. I do know, as I was making the timeline, I'm sure I am newer to Springfield, but many of you may have heard about the cobra situation from a long time ago, the 50s. So animal control responded to that. So they picked up cobras. Last year, I believe we had lemurs on the loose, and they assisted with that. So I don't know that there's anything they won't pick up, but they have picked up some unique animals. Yeah. Communicable disease. These are also, I think they're fun, but maybe some scary numbers. They have done over 2,000 case investigations. Zoonotic cases, as we call them, represent 2/3 of cases investigated. So these are animal-borne cases. So think rabies. I'm trying to think of another good example, salmonella. Yeah. Immunizations, over 2,000 vaccines administered. Our Vaccines for Children program represents the largest proportion generally of our vaccines administered. So as it says in the name, these would be vaccines in the children's series of vaccinations. So think infant and young child vaccines. Generally in Q4, which we have started this past month, shows an increase in flu vaccination. So we see that through the remainder of the year generally. Our STI clinic has seen over 2,000 patients in our clinic for testing or treatment. The difference that you'll see there, the 210 patients received treatment, it's not that, the difference there don't need treatment. It's just we do both testing and treatment. So we have quite a few people come for testing and then seek treatment elsewhere. So we did testing for over 2,000 and specifically did treatment for 200. And then finally, laboratory services. I told you that they interact with most of the programs in the department. They have run over 7,800 lab tests this year. So pretty significant caseload there.
Do you find there's a backlog of those labs? Because that's a lot. Or do they really stay pretty current?
They really stay pretty current. Yeah. Yeah, some of that 78,000 is the pollen count every day, and they deliver it before, I want to say it's before 9 a.m. every day. They're never late. Yeah. And then maternal child health. So for WIC, again, Women, Infant, Children's, that's our nutritional services program. It's, as I said, a federal program that we do the administration locally. Over 6,000 members are served per month. So good portion of our community. And then somewhere between, depending on the month, of course, 390,000 and $440,000 in benefits redeemed per month. So great benefit to our community members. Family Connects is that in-home nurse visitation program that launched earlier this year. Over 281 families have completed the program, and we've had over 650 referrals to community partners. So some examples of our community partners would be Parents as Teachers is one that people are generally familiar with. We refer to them a lot. They're a great organization. Any questions on these? What other questions do you have?
I
Yeah.
think, oh, go ahead.
Springfield participated in sort of thing for a breast milk bank.
There is. I would have to get back to you on the details of that. I believe it doesn't actually exist within the function of our department, but we do refer out to it. I want to say it's the Ozarks Regional Milk Bank. Yeah. Let's write that down. Do you have a question?
No, I was just thinking because you took questions during the session.
Mhm.
Questions at
That's
the
true.
end.
Do any of the other cities contribute to the services of the health department, or is it pretty much just Springfield and Greene County?
As it relates to our budget or the services
No, you're in, from your income.
so the budget. Well, so we receive funding from City of Springfield and then Greene County, which is funded through taxes from individuals in the city and the county. So yes,
So in that way, other cities contribute.
correct. Mm-hmm. Yeah. No other questions?
Hey, thank you, Anna.
Yeah.